There are two possible Galleri test results: no cancer signal detected and cancer signal detected. In this video, we'll discuss a cancer signal detected result. This result means DNA fragments that may be associated with cancer were found in your blood sample. We all know someone who has been affected by cancer. However, based on a clinical study, only about 1 out of 100 people aged 50 to 79 who take the Galleri test will receive a cancer signal detected result. A cancer signal detected result may come with a lot of emotions, but remember, Galleri is a screening test. A cancer signal detected result is not a cancer diagnosis and requires diagnostic tests to confirm cancer. A cancer signal detected result will also include a prediction of the tissue type or organ associated with a cancer signal, called a cancer signal origin. This provides direction to your doctor on the cancer's origin and helps guide next steps to confirm cancer. If you receive this result, your healthcare provider will order follow-up diagnostic tests, such as imaging or lab tests. GRAIL offers patients and providers additional support and resources if needed to help guide next steps. After diagnostic evaluation, around 40% of people with a cancer signal detected result are expected to have a confirmed cancer diagnosis. If no cancer is diagnosed after further testing, it could mean that the cancer could not be detected or it is in another location. It could also mean that no cancer is present. This is called a false positive result. If cancer is not diagnosed with a cancer signal detected result, it is important to follow recommendations from your provider, such as other tests to take or symptoms to watch out for. In all cases, be sure to speak with your provider about when to retake the Galleri test in the future and continue with all screening tests your healthcare provider recommends. Based on a clinical study of people ages 50 to 79, around 1% are expected to receive a cancer signal detected result, which includes predicted cancer signal origins. After diagnostic evaluation, around 40% of these people are expected to have a confirmed cancer diagnosis. The Galleri test is prescription only. The Galleri test is recommended for use in adults with an elevated risk for cancer, such as those aged 50 or older. It is not recommended in individuals who are pregnant, 21 years old or younger, or undergoing active cancer treatment. Galleri does not detect a signal for all cancers and should be used in addition to routine cancer screening. False positive and false negative results do occur.